Hi, my name is Dr Eldawy. I'm one of the medical oncologists with Sacred Heart Cancer Center. I graduated from the medical school in Alexandria University in Egypt. I did fellowship and residency first in Michigan State University, then my fellowship in one of Tufts University affiliated hospitals in Boston, St. Elizabeth. I practiced medicine for a few years before switching to oncology, and one of the reasons that I switched to oncology was during my residency, where I worked in thrombosis, and that's clotting disorders labs in Michigan State University, where I was introduced to the research in oncology and hematology, blood disorders. I practiced medicine for a few years before switching to oncology and hematology. And my first introduction to research in hematology was in one of the research labs in Michigan State University, thrombosis or clotting disorders labs. And then at that time, more drugs involving what we call targeted therapy, which is a newer class of drugs, came to the market. That when I picked oncology, I chose a program which was one of the very well-known programs in hematology and research in Boston. I worked in the hematology lab as well there, and I was involved in more of the clinical research and supportive care research there. I see all patients with medical oncology and blood disorders. I have special interest in breast cancer prevention and treatment, also in hematologic malignancies like lymphomas and acute leukemias. The work in oncology is many physicians and many patients feel it's a difficult job to deal with bad news almost on a daily basis. I feel it's one of the most satisfying things for a physician to help patients in those difficult times. Every patient I order a test on him or her, I'd be as anxious to wait for the results, and of course the good news is what makes me continue what I'm doing. When I first moved from a private practice to Sacred Heart, first before Sacred Heart, Pensacola as a city, I just loved the city itself. I mean, it probably maybe reminded me of my hometown of Alexandria with the water, and the people in Pensacola very warm, welcoming, and that was also another factor. In Sacred Heart Medical Oncology, I started when the practice was maybe 1 year old, and to me that was a challenge, how to make this practice bigger. The way we practice in Sacred Heart, we try to bring what we see in academics in a community practice or a community clinic, between research, between tumor boards. We do between 2 to 4 tumor boards every week, which is something we see more in academic settings. The outstanding team in Sacred Heart is another factor as well.